Good morning, Dylan Shays. I am Mihiraa. Let's start the warm-up sessions. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities, both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence, I chose nursing as my career.
What are the current trends in your profession?
Nursing is a dynamic profession and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in older days have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in present days, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Describe your typical working day.
My day starts with a prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after giving a handover to the next scheduled staff members.
What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
Your preparation time is over. You can now start the role play.
Good afternoon, Mihiraa. I'm Dylan Shays, the nurse assigned to your child's care. I understand that your child is scheduled to be discharged tomorrow. I wanted to go over the discharge instructions with you and address any concerns or questions you might have. How are you feeling about the discharge?
Well, nurse, I'm a bit anxious about taking my child home. I think it's too early to get discharged.
Mihiraa, I completely understand your anxiety. It's natural to feel this way when your child has been ill. Let me reassure you that your child's respiratory status has improved significantly. The doctors have monitored their progress closely and have determined that it is safe for your child to be discharged. This decision is based on her stabilized breathing and positive response to the treatments. While discharge from the hospital marks a positive step in your recovery journey, continued care at home is essential for your child's full return to health. This involves several key components working together. Firstly, consistent home care is crucial. This might include things like administering prescribed medications at the right times and in the correct dosages. Secondly, scheduled follow-up visits with her doctor are important to monitor your child's progress. These appointments allow the doctor to assess their recovery, address any symptoms, and adjust the treatment plan as needed. Mihiraa, by diligently following these steps, you'll be maximizing your child's chances for a complete and successful recovery.
Honestly, please tell me the status of my child.
Of course, Mihiraa. I understand how important it is for you to know exactly how your child is doing. Your child has responded very well to the antibiotics and treatments we've provided. Her breathing has stabilized, which is a very positive sign. The doctors have been monitoring their progress closely and are confident in their continued recovery at home. We wouldn't be discharging your child if we didn't believe it was safe and the best step for their health. With the right care and attention at home, we expect her to continue improving. If you follow the discharge instructions and keep up with the medication and follow-up visits, your child should be on the path to full recovery. Please know that you can always reach out to us with any questions or concerns as you transition to home care.
I feel nervous about Mia's recovery at home. Can you give me some guidance?
I understand your nervousness, Mihiraa. It's perfectly normal to feel this way. Let me give you some guidance to help ease your concerns. Firstly, it's crucial to ensure that Mia completes the full course of her prescribed antibiotics, even if she starts to feel better. This will help to fully clear the infection and prevent any recurrence. Maintaining good air quality at home is also important for Mia's recovery. If possible, use air filters or air conditioners to keep the air clean. Try to avoid exposing Mia to people with infectious diseases as her immune system is still recovering. When she goes outside, make sure she wears a mask to protect her from potential irritants and infections. By following these steps, Mihiraa, you can create a safe and supportive environment for Mia's recovery at home. If you have any questions or need further assistance, don't hesitate to reach out. We're here to support you every step of the way.
All right, I want to do everything I can for her recovery. Are there any additional home care tips you can recommend?
Absolutely, Mihiraa. There are several additional strategies you can follow to support Mia's recovery at home. Firstly, make sure Mia gets plenty of rest. Her body needs time to heal, so encourage her to take it easy and avoid any strenuous activities. Adequate hydration is also important. Ensure she drinks plenty of fluids, such as water, herbal teas, or clear broths, to stay well hydrated. A balanced diet will support her immune system and overall health. Include a variety of fruits, vegetables, lean proteins, and whole grains in her meals. Foods rich in vitamins and minerals will aid her recovery. Mihiraa, it's also important to monitor Mia for any signs of complications. If you notice increased difficulty breathing, a high fever, or a persistent cough, seek medical attention immediately. This could indicate that she needs further medical evaluation. Mihiraa, do you have any other concerns or questions about Mia's care? I'm here to help and provide any additional information you might need.